Nearly half of adults have high blood pressure, a condition that raises the risk for heart disease and stroke. Recently, researchers experimented using rats that had a genetic predisposition for hypertension, and they found that intermittent fasting lowered their blood pressure. The rats which were fed every 2 days ended up with much improved blood pressure in comparison to the rats who were fed every day. After further investigation, they found that this was because fasting caused reshaping of the composition of gut bacteria in these animals. It was found some bacteria contribute to hypertension by altering bile acid signaling, and periodic fasting appeared to reduce the population of these harmful bacteria and increase the proportion of beneficial bacteria. Researchers proved this by transplanting the gut microbes from the fasted and normally fed groups of rats into normal rats. The normal rats which were transplanted with gut microbes from normally fed rats ended up developing much higher blood pressure than those who received microbes from fasted rats. This study was published in the journal Circulation Research.